Hello, in this video, I'm going to talk about principles of strength training. So specificity and functional movement. So the specificity principle applies in strength training and in cardiovascular training and any type of training. And it refers to physiological adaptations in response to exercise that are specific to the stimulus. Okay, so if we have specific goals for our strength training, then it's important that we are training in such a way that we achieve those specific goals using specific exercises. So if we have a functional movement that we want to target, like if we have someone who is working on being able to walk up the stairs better, they need more muscular strength to walk up the stairs, then we're going to want to give them exercises that are very similar to walking up the stairs. So like we can have them stepping up on a box or a step or something like that. That is very similar to the functional movement we are trying to improve. Whereas if we target the muscles that we use when we're stepping up on the stairs, that's good. We might strengthen those muscles, but we'll strengthen them in a different way than is necessarily required for walking up the stairs. So when somebody has a very specific goal for movement or activities of daily living or hypertrophy or strengthening or whatever, we have specific goals that we are trying to achieve through our strength training. And so we need to make sure that we are using the correct exercises and completing them in the correct way with sets and reps and everything so that we can actually achieve those goals. So strengthening using one movement will not necessarily lead to improvements in a different movement, even if they use the same muscle group. And I discussed this a bit in my last video where I talked about the principle of specificity. And so if we do chest flies, it's not necessarily going to make us stronger at a bench press. So if the goal is to have a stronger bench press, you can only achieve that by doing more bench press. So compound movements using more muscles and joints are the most functional because they're similar to everyday movements. So when we talk about a movement being functional, we mean it's going to have function in our lives. It's going to make us better at something we do in our day-to-day lives, and that's what makes it functional. So somebody might argue that a chest fly, as an example, is not functional. It in no way resembles anything we do in our daily lives. It's a totally novel type of movement that we really just do for that exercise. It's not something that you need to be stronger at doing in your daily life. So we wouldn't call that a functional movement. It doesn't mean we shouldn't do it necessarily. It depends on what the goals are and what we're trying to get better at. But when we talk about functional exercises, we're generally talking about compound movements that are using lots of joints and lots of muscle groups. And those are the movements that most closely mimic the things that we do all day. Squats and deadlifts and all kinds of presses, pushes, pulls, and all sorts of planes and different joints. Those are the things that mimic, opening a door, pulling it open, pushing it open, walking up and down stairs, getting up from a chair. So those are functional movements that are the most similar to the movements that we use throughout our daily lives. So depending on who the person is that you're programming for, you might want to really focus on functional movements if those are the types of things that they want to improve, is just their day-to-day moving around and living in their lives. You need more functional movement. Somebody who has no problem with those things and instead is working on defining muscles and other things, then maybe functional movements aren't as critical. Depends on the person, of course. So alteration. So that's what we do to avoid adaptation. So our bodies adapt to the stimulus that we are providing. So when we are doing cardiovascular exercise or strength training or whatever, and we're using the same types of exercises and applying the fit variables in the same types of ways, then we adapt and we stop having new benefits. We stop having new changes in response to that stimulus. It's really not a stimulus anymore. So alteration is how we overcome that. So we might still be working the same muscle groups and even in the same planes in the same ways, but we can change how we are applying the resistance or the angle, or we can change certain aspects of the exercise to make that exercise now be a new stimulus to cause more physiological changes. So an example is like, maybe we've been doing a chest press on a machine for the last 2 months, like on chest day. And maybe after 2 months, now we change it up and now we're doing a flat bench press using dumbbells, or vice versa, or a bar bench press, or maybe you start doing an incline and a decline, so the point is that there's so many ways that we can change how we are working the same muscles and even in the same joint actions. And so we need to make those changes periodically so that we can avoid adaptation. Okay, intensity. So this really is related to specificity, is that the way we use the muscles tells the muscles how they need to physiologically change to be able to continue or do again whatever is the exercise that you're asking of it. So if we're asking our muscles to lift a weight repetitively, so like a higher range of reps, higher number of reps, so we're trying to get the muscle to contract and do many reps in a row with a lighter weight, then the muscle, of course, is going to adapt to become higher in endurance so that it's able to do that more easily next time you ask it to do that. In contrast, if you ask your muscles to lift a very heavy weight or a weight that's heavier than you normally lift, and you're only going to do it a few times, then that's going to cause your muscles to either increase in power and or strength, depending on how heavy and how many reps you do. But the muscle needs to adapt to be stronger and able to do more work more quickly. That's power, as opposed to endurance. Endurance isn't going to matter at all if you're only doing 2 repetitions or 3 repetitions. But power and strength are certainly going to matter. So how we stimulate the muscles to change is going to affect the types of changes that those muscles make. And so that's where we really need to pay close attention to how much weight we're using and how many reps and sets that we're using to make sure that we're achieving the specific goal. Muscle actions. So iso means the same. So isometric, metric like meter, same length. Isotonic, tonic like tone, same tone or level of contraction essentially. Isokinetic, iso as in same, kinetic as in movement or speed, so same speed. So isometric muscle actions or muscle contractions is when the muscle contracts and it's producing force, but it's not generating any movement. So you're holding a static posture. So that is the least effective when it comes to strength gains, or really any muscle adaptations, but primarily strength. So it's still worth something. It's better than nothing. I'm not saying like not to do isometric contractions. There's a lot of it in yoga and other types of exercise where you might be holding static postures. And so there is value, but it's the least effective compared to isotonic or isokinetic actions. Isotonic really refers to most of the exercise that we do, because isokinetic requires special equipment. So unless you're using a special piece of equipment that allows for isokinetic movement, everything else we're doing is isotonic. So meaning Like when muscles are contracting, we're going through a range of motion. Muscles are contracting eccentrically and concentrically. And it could be body weight exercise. We could be using machines, dumbbells, cables, all sorts of things. And that's isotonic. That is significantly more effective to achieve pretty much all of our muscular adaptation goals. Isokinetic means same speed. So you need specialized equipment for isokinetic exercise. And it's equipment that alters the amount of resistance as you're moving so that your speed remains constant. So as you're moving through range of motion, like let's say we're just doing a body weight exercise. As you move through your range of motion in that exercise, that would be isotonic. The exercise gets harder and easier as you go because of the biomechanical factors that are changing as you're moving through the range of motion. So the levers are moving, you have different lever systems moving differently, and your interaction with gravity is changing as you move through the range of motion, because the angle and the effort arms, the resistance arms, all these biomechanical factors are changing as you're going through a movement. And because of that, it means that your muscles have to produce more or less force at different parts of the range of motion to contribute and cause the movement, which means that you might go faster or slower throughout the movement at different parts of the movement because of the length tension relationship. So you have to go slower to produce more force, and you can go faster when you don't have to produce as much force. Okay, so in isotonic movements, we might fluctuate in our speed, and we might fluctuate without thinking about it because it's just a natural thing to do. And we might fluctuate on purpose, like you might go extra slow on the eccentric, or, there's different strategies there to emphasize different parts of the movement. But in an isokinetic movement where we're using special equipment, it's changing the amount of resistance that you're working against so that it's not easier or harder in different parts of the movement. It's basically making the resistance more consistent as you move through, which allows you to and causes you to go at approximately the same speed throughout the movement. So isokinetic is considered to be the most effective compared to isotonic, but that could be debated. It depends. Like if we emphasize the eccentric muscle actions and add more weight and emphasize and go slower on the eccentric, one might argue that that could be more effective for certain muscular adaptations than isokinetic. So these things are sort of debatable in terms of what is more or less effective. But it's pretty conclusive that isometric would be less effective than the other two. All right, so some more variables, some more things we can change are the types of resistance. Now, this list is in order from what is considered to be most to least effective for muscle strengthening. Okay, so isokinetic machines, like we were just discussing, that would be the most effective. Then free weights and machines are very effective, but arguably maybe not as effective as isokinetic machines. Then elastic bands or tubing is considered less, I don't want to say the least effective, but less effective than any of the others. And then body weight and isometrics would be definitely the least effective on our list here. So there are certainly reasons to do the things at the bottom of the list. So somebody who is injured and maybe you're helping to rehabilitate an injury, or certain populations. So there could be an elderly person who maybe needs some strengthening of neck muscles, which is a very delicate area to work in strengthening, and especially in somebody who's elderly and maybe you don't know exactly what's going on in their spine. So there are reasons that you might want to start with something gentle. Like you could do simple isometric exercises like giving resistance on the head, and they can resist isometrically and work on strengthening very subtly and very carefully the neck muscle. So that's an example of how that might be useful. Body weight exercises, again, somebody who is maybe a novice, they're not used to strength training yet, and maybe you need to start with some fundamentals like good squat form, just basic, how do you move and use your body in a correct, safe way before you start loading weight or using any kind of resistance. Elastic bands and tubing, those are very useful in rehabilitation settings. So if you're rehabbing a shoulder that just had surgery, or all sorts of things, it's a more gentle, low risk way of applying resistance in a very controlled way, which is very necessary when somebody is rehabilitating after an injury or a surgery. And then the idea is, if you do start somebody with, isometrics, body weight, elastic bands, that you would progress them and move up into machines, free weights, and maybe isokinetic machines, depending on what you have access to. So ideally, you work your way up so that you are applying greater and greater, more effective types of resistance as you work your way up through this list. Okay, it is critical that we balance muscle groups when we are strength training. I've had lots of patients over the years where I've worked on rebalancing, where they'd have shoulder pain or back pain, neck problems, all sorts of orthopedic issues, injuries that were caused, or just musculoskeletal pains and problems, where it originated with imbalanced muscle relationships. Now that could be due to like postural distortions, or the way somebody is sleeping, or activities that they're doing all day long that they're not realizing, they're overemphasizing one action or one muscle group over another. So that could be the case. But I've also had a surprising number of people who have sort of done this to themselves by strength training and not balancing their muscle groups. A very obvious example that I've seen too many times is when people do a lot of chest. So people go in and do like chest and biceps because they want to work what we call the show muscles, so they might want to work the big muscles that seem more obvious and make them look bigger and stronger. But if you neglect the opposing muscles, then you end up with these shoulders that are internally rotated, and protracted scapulas and forward head posture, and you end up with all kinds of neck and shoulder problems as a result. And that's one example, but you can end up with a lot of muscular imbalances by focusing on a certain muscle group and neglecting the opposing group. And so you see that more often in like casual lifters, like people who don't necessarily like really know how to program and plan what they're doing. And so there's a lot of people who go to the gym and they kind of learn what to do by observing others, and they kind of pick things up as they go. But the problem is that if you're picking up what you see and working with what you are figuring out as you go, instead of learning how to balance the muscle groups, you might end up overemphasizing certain groups and causing dysfunctions that can be very painful and can cause osteoarthritis. It can cause faster breakdown of the structures inside the joint, and overuse injuries, and a variety of other problems. So my personal favorite way to make sure muscle groups are balanced is to split based on push-pull. It's a really common way to split your workouts, is to do push-pull workouts. So like, let's say maybe you divide your week into upper body, lower body, trunk, just as an example. Well, on upper body day, You need to make sure that you're doing an equal amount of pushing exercises and pulling exercises. Lower body, pushing and pulling. Trunk, pushing and pulling. So for upper body, pushing would work chest, deltoid, tricep. So pushing could be like bench press, shoulder press, like a tricep extension. Pulling, could be like a lat pull down, could be a row, could be a bicep curl. Lower body pushing would look like squats or leg presses. Pulling would be like deadlifts. On the trunk, what is pushing and pulling? We could kind of debate because it's not quite the same thing, but you could equate pushing in the trunk to being like trunk flexion, so like abs, and pulling could be like trunk extension, so like back. And so you could divide upper, lower, and trunk that way, or you could do it like you have pushing day and pulling day where you work the whole body, but pushing. So like on one day you might be doing chest, deltoid, triceps, squats, leg press, trunk flexion. And then on a different day, you might be doing pulling. So back, biceps, deadlifts, trunk extension. And so there are countless ways to program and come up with how you want to split. But if you're thinking in terms of pushing and pulling, that's a really good way to make sure that you are getting your antagonist pairs. So you're getting your opposing muscle groups. Another good way to do it is to work in planes of motion. So you could have like a day where you do frontal plane exercises and making sure that you're working opposing actions within the frontal plane. So like frontal plane would be like adduction and abduction. So you might do like abduction exercises and adduction exercises at all of your joints. So at all the different segments in the body. And so that way, if you're working both add and adduction, then you're working the antagonist muscle groups and making sure that you're remaining balanced. So you might have a frontal plane day, a sagittal plane day, a transverse plane day. Maybe you have an oblique plane day or a multiplanar day. There's so many ways and you can be very creative. But the point is to make sure that you are getting the antagonist pairs so that you keep the muscle strength relationships balanced. All right, then there are a handful of other kinematic variables to consider when you are programming for yourself or for someone else. So closed chain versus open chain exercises. So we are referring to here whether the distal segment of the limb that you're working is anchored and like maybe anchored on the floor, or your hands can be anchored on a bar, like for a chin up. So that would be closed chain, or open chain means the distal segment is freely movable and not anchored. So you want to do a variety. You want to do both. Closed chain exercises will be compound exercises, and they're usually more functional and work more and larger muscle groups. So you want to focus on those first because those are going to work your bigger muscle groups, and you don't want to tire them out using open chain exercises first and then impair your ability to complete the closed chain exercises at a heavy enough weight and a great enough capacity. Now, we might be able to argue for occasionally doing open chain first, like if you want to pre-exhaust those muscles to focus on others. So, I mean, there's different training strategies there, but as a general rule, closed chain first, open chain second. So that might mean pull-ups first as closed chain, and then bicep curls to finish off bicep. So the pull up or chin up would be closed chain, and then like a bicep curl would be open chain. Then compound or single joint movements. So compound meaning multiple joints in that movement. So like squats, leg press, push-ups, pull downs, all those sorts of things. So multiple joints, that would be a compound exercise. And then single joint would just be like an isolated one joint exercise where you're targeting one muscle or one small muscle group. So again, compound exercises are going to be more functional. They're going to work the bigger muscle groups. And so you want to do those first because they're, for most people, going to be more important. So you want to make sure you're doing the best at those, highest performance, most energy available, least amount of muscle fatigue going in. And then use single joint exercises after that, just to use up any remaining efforts that you still can exert from those muscles. Size of muscle groups. You want to go from larger muscles to smaller muscles for the same reason. So these first three rules here all really are they're kind of saying the same thing, but from a different perspective, because the closed chain muscles or the closed chain exercises are also going to be compound and work larger muscles. The open chain exercises are generally going to be, I mean, this isn't always true, not always true, but usually more often they're also single joint exercises and more often working smaller muscles. Okay, so if you follow any of those three rules, you're probably following all three at the same time. Then joint range of motion, whenever possible, go through full range of motion on every repetition on every exercise. Now, how we increase flexibility is debated. Okay, so there's a lot of scientific debate about the best way to improve flexibility. And there's a lot of debate about different types of stretching and whether we should stretch at all or what types of stretching we should do or when. There's a lot of debate. I would argue, and now this is my belief based on my assessment of the literature and my professional experience, but my view here is that the most effective way to increase flexibility is through strength training through your fullest range of motion possible. So I would argue that passively stretching, so stretching muscles into a range of motion where you're not able to actively contract and move your muscles themselves, I would argue that that's not good for you, that that's not ideal for your muscular function or for your joints, that it's going to interfere with muscle contraction, ability to produce enough force, ability for your muscles to protect your joints as you're moving and doing things. So I am not a fan of static or passive stretching. But if you're contracting your muscles and you are exerting force and using your muscles through their fullest range of motion through the entire exercise, then that's a way to not only strengthen your muscles, but to strengthen their ability to move and be used through its full range of motion, which is going to have a protective effect for your joints. It's going to offer more stability and robustness of your joints as you're moving through that full range of motion, just in normal life. So I would argue that the best way to improve flexibility is to strength train through the fullest range of motion on either end at your extreme ranges of motion. Because then you're not going into a range of motion where your muscles are not able to contract and produce enough force to cause movement. And so I would argue that we shouldn't be moving our joints into range of motion that our muscles can't move us into. But again, that is very debated, and there are a lot of different viewpoints on that subject, but that's my scientific opinion. Then balance and stability. So when we are strength training, we have lots of opportunities to add balance challenges to our exercises. So like instead of just doing a body weight squat on the floor, you could do a body weight squat on a Bosu ball or on a foam mat that's going to change the stability of the exercise. So there's all sorts of ways that we can challenge our balance and stability while also doing our strength training. Now, keep in mind that the more challenging an exercise is for balance and stability, the less weight you can or should be doing for that exercise. So for somebody who power or strength is the primary goal, you're not going to want to add a lot of balance or stability variables to their workouts because that's not their main goal. And it will interfere with being able to use enough weight to achieve the strength and power goals that they have. But if somebody's goal is to avoid injury in their daily lives, like maybe they're having a hard time moving around the house or going up and down stairs, and you want to improve their balance and stability to prevent falls or other types of injuries, then it's worth foregoing the extra weight they might be able to use in strength training in favor of adding more balance components to help improve and meet that goal. So it depends. Again, it's very individual and it depends on what the goal is of the person. All right. Thank you so much for watching, and I'll see you in the next video.